Even with reopening moves being made and more vaccinations being given out, UW's Institute for Health Metrics and Evaluation projects a tough battle against COVID that will continue into at least the spring.
There is definitely more work and more discipline ahead for all of us. And according to the IHME's current projections, the world could see 3.4 million deaths by May 1st. That would mean more than 1 million more deaths over the next 3 months. It is forecasting more than 150,000 more deaths from COVID here in the U.S. over that same time.
But also at the same time, again, the IHME is expecting a drop-off in new infections from now through May, both here in the U.S. and around the world.
Joining us now to talk about the virus trends and reaction to the latest COVID headlines is the UW's Dr. Ali Mokdad. Doctor, the vaccinations are going out, so when will they start having an effect, leading to a decline in cases and hopefully people getting back to normal?
Once we reach a herd immunity, right now we don't have enough vaccines for everybody who wants them, and we're not there yet. So we need about 80% of our population to be vaccinated in order to reach that herd immunity, and we will be out of this pandemic.
Yeah, doctor, so a lot of people right now are carefully watching what the variant strains are going to do. So I know you guys are all about data. How do you see the variants affecting the cases here across the country?
So we're concerned about these new variants because they're more likely to be transmitted. So we have one B117 from the UK, and we have another one from South Africa, B1351, that we are concerned about. Both of them are more likely to be transmitted. We know the UK version is 50% more likely to be transmitted, and the one from the South Africa is associated with higher mortality as well. But the most worrying part about the one from South Africa is that it makes the vaccine less effective.
Dr. Johnson & Johnson making big news today about its single-dose vaccine. It was 72% effective at protecting against moderate to severe illness here in the U.S., but it was 66% effective in Latin America and only 57% effective in South Africa, where concerning variants have taken root. Knowing that, will it have a significant impact? How big of a player will this vaccine be?
It will have a big impact for us in the United States. It's a single dose, that's one. Two, also it doesn't require as much refrigeration like the other vaccines that we have right now at hand, -75 for Pfizer, -20 for Moderna. So it's a game changer. It's less effective, of course, especially with the variant from South Africa. But remember, we approve vaccines in the United States through FDA at 50%. So this is above what we require, and it will help a lot.
All right, Dr. Mokdad, thank you so much for joining us. We always appreciate your insight. Now let's take a look at today's national pandemic numbers.
Johns Hopkins University reports more than 168,000 new cases across this country. The U.S. is approaching 26 million total cases. 4,000 more people have died to bring the country's pandemic total past 433,000.
The top 3 states in terms of new cases continue to be California, Texas, and New York.
Our state has seen nearly 308,000 total cases, while test positivity is still hovering above 6%. More than 4,200 people have died after battling the virus here in Washington. As for new cases around the Sound, King County is reporting 663 new cases this evening. Pierce County added 221, while Snohomish County is only reporting 45 new cases today.